Honored right now to have Congresswoman Ann Wagner from the 2nd Congressional District in the studio with us. Welcome.
Great to be here. Great to be here in studio and great to be back. We're just outside of Missouri's 2nd District, but the big metro area,
That's
so
right.
always good to be home.
Down here in Lacey Clay's territory, you better be careful.
That's right.
You got to watch out.
We've been working down here all morning.
Yeah, you've been volunteering somewhere, right? Where'd you do?
We did. We got together with New Balance Shoes. It's and Kaboom. It's a part of their kind of the 4th year of their global volunteer week, and they're doing this all over the country, frankly, all over the world. And we spent several hours this morning putting together playground equipment in Gravi Park, which was
nice.
Really cool. I was pretty good with the lug wrench, if I do have to say so myself. So, yeah, it was very, very cool. But I have to say I don't smell so very good, but I'm wearing my New Balance T-shirt. So.
I didn't notice it all. That's why I put you down there by church. No big deal. Great to have you in the studio, though, because you guys are on a little bit of a break. You've been able to go out and talk to some constituents, right, since you've been back?
We have. You know, we had a great Memorial Day weekend and unveiled a wonderful new memorial in Jefferson Barracks, which is in the 2nd Congressional District, honoring all the Gold Star families and their fallen since 9/11. So we have upwards of 180 Missourians across the entire state who lost their lives in the global war on terror and all of the operations that have been going on since 9/11. And a beautiful memorial. I want all your listeners to go out and see it. It has the faces of all of those young men and women that gave the ultimate sacrifice for their country, and got to speak at that unveiling and share some great stories and tears and laughs with the Gold Star families, whom I love so very much. And also did something with the Vietnam War vets, which was very moving. And then, we've been working out at Charter, a brand new unveiling of their big veterans program, frankly, that they're going to expand from Missouri out to about 41 different states. Yesterday, we had y'all come to the office and met with one constituent after another, folks that want to talk about health care, folks that wanted to talk about the budget, folks that wanted to talk about... There was a 12-year-old boy, Mark, who wanted to come in and talk to me about malaria nets. I mean, we had a whole scope of different things, and it was a great fun afternoon to actually sit down and connect.
So I'm assuming none of the crazies made it to your office yesterday, like the ones that attacked your home?
Yes, well, you know, that can still persist at times, but my deal is this. I'm happy we can have our disagreements on policy, but if you want to come in and meet with your member of Congress, meet with our staff, conduct yourself in a civil manner, then I'm happy and open to talk to you. I had one mom in there who brought in her 4-year-old son on Medicaid, foster child that they had adopted, and she was really very anxious and very concerned about his future coverage. And to be able to hug that mom and put at ease her concerns about the fact that this country, this state, this Congress is going to make sure that we take care of her 4-year-old son, Nathaniel, so that he's got good services and medical care over the course of his life was important to me. And I'm sick of the misinformation and the lies being told out there about the new AHCA that we've put forward in terms of the repeal and replacement package moving through Congress. It's in the Senate's hands right now, but we're trying to be the truth squad and reassuring people that we are a compassionate country that's going to take care of those with pre-existing conditions, but we're in a death spiral, and we got to do something about the current plan.
And that's the Medicaid reform that's included in that package that you're talking about, right?
Correct. We'll absolutely continue to take care of the disabled, the children, the elderly. What we're doing is empowering states who actually know their Medicaid patients better than anything coming out of Washington, D.C. or the federal government, empowering them to be able to have more ownership in the program. So it's a good reform package that's still going to take care of those that we need to take care of.
You know, and the pre-existing conditions. I mean, I know that's something that they kicked around in the House, and then it's over in the Senate, and there's still people that aren't crazy about that provision who believe that the government shouldn't have a role in requiring anything of private companies like that. But it's in there, and how did you feel about the option of letting some states opt out and then, you know, sort of handle it themselves in high-risk pools and things like that?
Well, of course, every state can handle it however they'd like to. Whatever we can do to decentralize any law or piece of legislation and return power closest to the people at the state or local level is important. I want to make sure that we're taking care of people with pre-existing conditions and offering the kind of essential health benefits that I think are important to them. But the key here is everybody has a right to health care, but health insurance is what is important, and there are responsibilities that an individual has to make on that in terms of continuous coverage, not gaming the system. We're going to give them access to something that's affordable. Right now in Missouri, the new news as of last week was that Blue Cross Blue Shield, Kansas City, pulled out.
Right.
25 counties now, by the first of the year, will have zero health care coverage under the failed Obamacare structure. Only remaining 77 counties will only have one provider. So this isn't a death spiral. We've got to do something, and we think we're acting responsibly. We hope the Senate will move something through so we can conference, come to a package, and take care of this issue once and for all.
You said, I want to give you a chance to clarify this. You said a right to health care. Do you mean a right to access to health care?
Well, anybody can walk into an ER and get health care.
Right.
Okay.
Right.
But health insurance isn't always health care. And I want to give them an opportunity to have access to it. But that should be an individual's choice. I mean, right now, there are some 14 million Americans on Obamacare that are paying a penalty. They don't want the insurance,
right.
But we shouldn't be penalizing them for it. That's an individual's choice and decision that they have to make.
Well, I changed jobs in the middle of last year, right? I started this job in April of last year. When I went to get my taxes done in February, the guy says to me, "Were you without insurance any time during the year?" And I'm like, "Well, I had a brief period of time when I changed jobs. There was no carryover." He said, "Did it last the first of one month to the first of the next?" And I said, "No, it was in the middle of the month." He goes, "Okay, it's not a problem. But had it lasted one full month from that included the 1st and the 30th, you'd have been penalized $2,500 for not having insurance for 1 month." That's crazy.
It is crazy, and that's why a lot of people will get COBRA or some kind of a package to carry them over. What we have now under Obamacare, there are a number of folks that are only paying really for 9 months worth of health care coverage because they then have a 3-month period of time, so they can stop paying after that ninth month, get carried over, and then start up again on January 1. We don't want people gaming the system, frankly. And we also have to have a certain perspective. A vast majority of Americans have their health care insurance either through Medicare, Medicaid, or their employer. In fact, in Missouri's 2nd Congressional District, we only have about a little north of 34,000 individuals in a district of 767,000 that are on Obamacare through the individual exchanges.
Right.
So, but
let's talk about the CBO score for a minute. The numbers they threw around sound huge. They filled all the headlines, 20 million, 23 million going to lose coverage. A percentage of those are people that are without coverage currently, correct? That's added in there, plus the people who would be affected if there's Medicaid reform like we'd like to do, which would lower or should I say, would lower the family earnings amount for which you could qualify for Medicaid, correct?
Correct, and that would kick in around 2020. But I can tell you right now, currently, as we stand, and what's so wrong, first of all, CBO scores are entirely wrong. They've gotten everything wrong dealing with Obamacare in terms of how many people would sign up, how many people would be insured or not insured. But presently, as we speak, they estimate 19.2 million Americans do not have health care coverage because, Mark, they either have one of the hundreds of waivers you can get one way or another, or they just choose to pay the penalty. What we want is something that's affordable, that is patient-centered, and that meets the individual's needs. For instance, if you want to belong to some kind of a pool or catastrophic care pool, a lot of young people, right? They just want to go to Doc in the Box,
right,
whatever it is, to get their strep throat or some stitches after a pickup game of basketball. But if they get hit crossing the street out here, they want catastrophic coverage, but they don't want to pay for pediatric dental and a whole lot of other things. So there are all sorts of association health care plans, co-op plans, things that if we can put this back into the free market and allow companies to tailor these packages that are affordable to individual needs, I think it's going to do a lot to lower our healthcare costs, which at the end of the day, that's what we want to do, is bend that cost curve.
No, I agree completely. The essential benefits, were those included in the HCA or not? Were those stripped out?
Any of the essential health benefits will be, they're included, and it's up to a state if they want to ask for a waiver.
Oh, okay. All right. Well, that's good.
Yes.
Because I think that's driving the cost up some myself.
Could very well be. And states can offer or can ask for a waiver. Governor, legislature can do so. So we're just hoping that the Senate will move quickly. They seem to want to, start from scratch again. So we'll see how far they get.
Which is tough if it's in reconciliation, right?
It is, because we have until the end of September to get that done in this budget. So they need to get off the dime and get moving.
That's Congresswoman Ann Wagner, who's our guest in the studio at this hour. We're going to continue with